Welcome back to another episode.
Hello, hello. Today we are talking with Dr. Andrea Orvieto. She is a doctor of acupuncture and Chinese medicine in South Florida as the founder of SoFla Acupuncture and Wellness in Hallandale Beach, Florida. She's got a fellowship with the Acupuncture Board of Oriental Reproductive Medicine. Wow, hey girl. And specializes mostly in integrative fertility care and has advanced certification in pelvic floor therapy. Her other clinical focuses include, well, fertility, of course, women's health, pelvic floor dysfunction, as well as acute and chronic pain and other complex conditions. And in doing this, she's blending the wisdom of Eastern medicine with evidence-based approaches, which really brings a whole new light to all of this. In addition, she's got a beautiful, wonderful social media presence, and she's a heck of a dancer. And she will entertain you for days. So welcome, Dr. Andrea. We're so glad to have you.
I'm so
Welcome.
happy. Thank you for having me.
Yes. Thank
I've
you
been
so much.
looking forward to it.
So we met Dr. Andrea at Pinnacle Conference in Austin a few months ago. And I think Erin and I were both really enthusiastic about you and all of the other acupuncturists because you brought such light to the whole group. I think most people think of Pinnacle as the people in hospitals, the, internal medicine docs, the OBs. But we were there as the two of the three dentists, and you guys, I think, had 7 or 8 acupuncturists.
We brought 11.
Okay.
Wow.
I thought it was amazing how much you all brought to the table in terms of practice ownership, in terms of patient care, in terms of blending medicine, both traditional and modern medicine, and just the incredible way that you interact with the public through social media and education through that, which I just thought was great.
Thank you. I am fortunate enough to have been introduced to these amazing women, my other acupuncture colleagues, and we met through a business mentorship, and we've stayed in touch very closely. We live all throughout the United States, so any kind of excuse to get together, we always jump on. And we have a colleague that practices near Austin, and she says, "Hey, have you been?" So she's like, "Who's in?" And we're in. And we have a big want and feel the pull to show the medical world that, hey, we're part of your world and we're team. We are not the one extreme or the other. We want to blend both. And so we have taken upon ourselves to integrate ourselves with Western medicine because we are not stupid. And for lack of a word, we know the importance of both and we are the ones that we get those patients that are all set and angry and they are done with Western medicine. Their doctors don't listen. And so we said, well, hey, let's pump the brakes. We understand and we can help you to a certain degree, but we need our Western medicine. It's so important. And so we think, hey, how can we blend ourselves with the Western world to understand exactly what we do and show we are a team and our patients are the center of that circle. And we thought Pinnacle was the perfect place because they had never seen acupuncturists there. I know there's a few physical therapists, but never acupuncturists. And like, what do acupuncturists do? And we wanted to kind of break that ice between us, and Pinnacle was the perfect place because it is that place where it's mostly medical doctors, surgeons, internists, and it was the first year that there were any of us, and there were 10 or 11 of us. That's a lot.
It is. And especially, and it's funny because I know that in practice, there is a lot of talk of acupuncture, especially, and we'll get to this later on, but it's amazing in the OB world that you guys introduced yourselves into it. It hadn't really been advertised to you. So I love that. I think that's great.
No, not everybody works with women's health. There's many acupuncturists, like they're orthopedic acupuncturists and different people that work with eyes, ophthalmology, for cataracts or macular degeneration. I'm not in that world at this point, but that could link up with the Western doctors that do that.
I love hearing that story about going, maybe a strategic maneuver for you guys to go too, because one thing I wanted to say was I admired that you guys showed up and so fully and so confidently, because it can be so easy to go to these events and feel like this isn't for me. I'm not the right person that's supposed to be, we're not
I
real
felt that way.
doctors. We kind of, yeah, I was gonna say, we kind of felt that way as dentists. Like, we kind of felt like we got shoved in the dentist corner, and we felt a little awkward at times. And so you guys were just there, seemed like loving it and embracing that. And I think that speaks a lot to you guys and the confidence of who you are and what you're doing, especially when
Yeah.
I don't know what it's like to be acupuncturist, but I can see even being a dentist, since we're not like traditional physicians in a way, sometimes we kind of get relegated to the
Right.
outside of
You're like
traditional
in
medicine as well. And it's easy
Sure.
to have kind of a chip on your shoulder about that. So I love that you
Sure.
guys just really leaned into
Well,
that.
I'll share a story with you, and I haven't shared this story
So,
with
We
anybody.
love
Yeah,
spilling the tea
I'll share.
here.
I'll share this story with you, and I hope that this story reaches some of the people that it should reach, because we almost didn't come. Okay, we were all signed up early. We signed up like August of 2024, right? Like it was like early bird. So a ton of us signed up. So Pinnacle was in May. I want to say it was like February, maybe March. One of the founders of Pinnacle put out a reel saying what acupuncture can do when it comes to fertility. And the only thing that this founder put out was that acupuncture can only help with stress and
mm,
IVF. Okay. Which is very far from the truth. And that's okay if this is what, if they were saying like one of the things that can be. So in this reel, a lot of us started to comment, not angrily, but just, hey, there's evidence based research that shows differently of all of the things acupuncture can do when it comes to IVF and different things like that. And instead of making a comment about, you know what, let me fix it, they deleted the reel.
oh,
And so a lot of my colleagues, one of them was like, I don't want to go anymore because they don't support what we do, and we paid a lot of money to show up there. And I never felt that way. I never came from a place of like, well, I'm not going to go. It was also my first trip away from my kids and my husband, so I was like, I am going, and I'm staying at the Four
Bravo.
Seasons. But to make a longer story short is that she wasn't able to receive a refund, and we all decided to go anyway. We were a little bit hesitant of like how we would be accepted. And I saw this doctor, I got there on a Thursday, and I saw her, and she was with Dr. Shiva, and I introduced myself. And I just, because I funny enough is I know Dr. Shiva through a family friend, and I was like, I know I'm going to say hi to her, and they happened to be get together. And you know what, we made a name for ourselves. We were coming, and we were coming with a lot of us, and they actually welcomed us, whether or not at that moment they felt that what they were saying was true on that reel, or they decided instead of responding, we didn't feel pushed to the side. I'm happy that we all went, and I'm happy that nobody backed out, and I'm happy that we felt welcomed, and we're all going back next year. So
that's
yeah.
awesome.
I love
I
that too,
think,
because I find that women in this space, in medicine in general, how many times has that happened to you, Erin? So many times where somebody says something and maybe it's out of ignorance, maybe it's because they were just in a hurry and weren't thinking it through or whatever it is. But then you're like, oh my gosh, well, I guess I just don't belong here. I don't
Right.
belong here. And so you step back and you take yourself out of the equation because you don't, we don't have time and space and energy for that stuff.
Right.
We just don't, like, just don't. And so I'd rather go somewhere where I'm accepted. And so I'm like, I just think it's amazing that the way that you guys showed up, and
Thank
it
you.
didn't matter. Like, I didn't see that reel. And even if I had, it would have
Right.
like just blown
We all did,
past,
and we all were like, "Oh." And then you kind of have to take a step back, and you're like, well, what message was this reel trying to show? Like, okay, we know more. We can prove that. Was really thinking that they didn't show the other stuff and kind of knew what was happening. With
Mm,
that being said, we're not their audience,
right.
yeah.
right? But what I was hoping and what we were hoping going to Pinnacle was that in the future, whatever that looks like, is that that would be thought about a little bit differently and maybe worded a little bit differently. Is one of the great benefits of acupuncture that could come with IVF can be it's really great for stress reduction, which it is.
Right.
Yeah, for sure.
IVF or not.
Our last episode, we talked about how, as oral maxillofacial surgeons, no one knows
I
who
was
we
listening
are
to
or
that
what
one.
we do. And so that really resonates with us. And I think so much of it is just education and having those opportunities to be, and in this instance, literally in the room to communicate and to educate and then to see what we have to offer. And that was one reason I wanted to have you on the podcast, because what I know about acupuncture is that Dr. Sarah and I, we poke people with needles all day, every day, and they hate us for it. And you, for some reason, poke people with lots and lots of needles, and they choose to come to you and probably pay cash most of the time. So, what am I missing? What are we doing wrong? And what are you doing right? What can you offer? I want to hear all about what can you offer. I also would say, coming from like more traditional medicine side, this sounds very woo to a lot of people. So what kind of evidence do you have for acupuncture? I tend to lean towards this is one of those like ancient remedies that we've been doing for, thousands of years.
Thousands
Am
of
I
years?
right? So there's got to be something to it, but like what does the science show? I'd love to hear your perspective on this.
Sure. Well, first and foremost, our needles are very fine and thin.
What gauge are they usually?
I have they're in Japanese. I'm gonna show you them 1 second.
Okay.
Hold on. I have different gauges. They're not hollow here. This is a 25 millimeter is really thin, right? So it's an 18 by 25 or point. So it's like
I can
Okay.
very
hardly see it.
flexible.
Yes.
It's hair thin. So
It's like the smallest von Fry.
Yeah, I know.
Filament.
yeah,
Von Fry filament.
There we go.
it's super tiny. They're not hollow. They're solid. And so because they're not made to hold anything, take blood or hold any liquid in, anything like that. We're not injecting anything with these needles. So
So many questions.
yeah, I have the answer. So and
That's
if I
why you're
don't, then
here.
if I don't, then I'll refer you to where you can get them. So one of the most beautiful parts of acupuncture, which I think also makes it really difficult for some people to connect, is that it's a very abstract medicine. Like there's a lot to it, and there's a lot of imagery that we use, which is usually not the case in medicine. Medicine is typically very black or white. There's a problem. This antibiotic is your solution, or if there's a problem in the mouth, this is our solution to that problem, right? We don't have to think about what that looks like or imagine highways running through the body, right? So it's difficult in that way. With that being said, when thousands of years ago, they were able to determine different parts of the body that connected with different areas, not understanding where the nerves went through the body or the blood vessels went or which bones were they didn't have names for that. And it shows through what the acupuncture points are called. But with that, there is a very real thing that happens in the body when you get acupuncture. There was a study that was done years ago, and that showed that literally no matter where you put the acupuncture needle, that you were able to determine that there was endorphins being released in the body and serotonin and a lot of happy hormones that were being released, or pain reducing hormones to be released into the body. And then obviously if we have a specific points prescription that somebody's coming in for, and we put the points on the body, then obviously we have an even better impact on there. So what do I mean by that? There are 12 main channels through the body. And with that, there's also hidden channels. So think about the body as highways and streets and entry points, exit points, shortcuts. This street connects with this street and all that. And if we have a crash on a major highway, that will not only back up that highway, it usually backs up the oncoming traffic, the traffic going off. It even slows down the opposite traffic because people like to look, or maybe that's where police are coming from, or highway patrol, things like that. You think about the acupuncture needle as the ambulance or as the highway patrol coming in to clear the accident and help, and then traffic flows a little bit better. Acupuncture is used to get your body to flow in the way that that it should. Whether we're talking hormone health, we know that if there's a dysfunction in hormone health, all of the things that can potentially go wrong. We can talk about it in pain. If we have blood restriction or scar tissue built up, it impacts the blood flow to certain areas. And with acupuncture, we can free up that area to help decrease pain. It's really great for digestive stuff. So the acupuncture needles are just one part of traditional Chinese medicine. And we basically are trying to reboot the computer. We are using acupuncture needles and acupuncture points to reboot the brain, to tell the body what to do again. So you can take it as a computer, right? We're trying to teach the brain what to do when there's so many things going on in the body. The check engine light starts to flash and the body doesn't know where to go. Do we go to the head for the headaches? Do we go to the shoulder because of the pain? Do we go to the reproductive system because our brain is not telling the hormones to really, to communicate with that? And so when we can get the body to function the way that it should, things start to flow in a much better and more fluid fashion. And acupuncture isn't the only part of Chinese medicine. We use herbal medicine, so that's our pharmacy. We have hundreds of herbs, and when they put them together, there's different properties of different herbs that they really enhance the properties of each other to help with sleep, to help with depression, to help with headaches, to help with pain, to help with polyps and fibroids and cysts. And in that, we also have to learn the Western pharmacology because we have to know what interacts with what, so we don't prescribe it in that.
And how are those herbals? I saw your like a squatty sauna. Can I call it that?
It's a yoni steam, but I kind of like the
Yes.
squatty sauna sound
Thanks.
too. That's like, okay, so
But how else
I'm
are they
so lost right
administered?
now.
so we have a yoni steam, which is basically a vaginal steam bath. And we can administer herbs for people to take and use orally
Okay.
in a tea or a pill or a tincture or whatnot. There's also herbal formulas that are used for pain topically or for wound healing topically. And then there's also herbal formulas that you can steam, and the steam bath can go into like you use it for the vaginal canal to help with different things. So we can use that for postpartum, for perimenopausal, menopausal symptoms like vaginal dryness, reoccurrent yeast infections, UTIs, candida, built up like that, endometriosis, or cysts, fibroid type things. It's to help to basically shrink those cysts. We can't remove them without surgery, but there's a way that we can help to reduce them with herbs, and they're very powerful. I always tell patients is don't go and just like whatever's trending on TikTok or Google or whatever, because
Unless it's
if
you.
unless it's me. No, I don't do that. Unless it's coming from me. But I also am very careful. I do not really I speak about supplements generally. I speak about herbs generally, but I always tell patients if they're strong enough to help, they're strong enough to hurt. And so if it's not for you, just like supplements in general, if it's not for you, it's not for you. And it can really mess some things up.
So we have a lot of the same, because we're not quote unquote traditional medicine. I think that a lot of times our patients come in with non-specific issues, and we have to be creative in terms of diagnostics and addressing it as well. And so it's not always a cut and dry, here's your problem, here's your solution. I like to think that because tooth hurts, we take the tooth out. Great, yay, woo. But there's so many other facets to what we do that we also have to have those same roadmaps and thinking through these little roadmaps and where is this inflammation coming from? It's not clear here, but where is it coming from? And so we have to use sort of that third eye or whatever you want to call it to really like be able to see. And so I think that that's an interesting part of what we do. And I don't know that all people do that. But I know that Erin and I both have that sort of sixth sense with what we do. And it's very helpful. So I totally get what you were saying.
Most of my patients coming in don't want to hear the history of Chinese medicine. They don't understand it. And when people don't understand the language that I'm using, that can sound very scary. So I typically don't use that language in my practice with my patients. I try to make it so they understand what I'm talking about, and I know what I'm doing when it comes to Chinese medicine. And I translate it. It's like translating it into a completely different language. It's similar to you. You're not going to use all of the fancy medical terminology because, first of all, like that's it doesn't make sense. It's usually large words that can scare patients. And sometimes it's not a scary thing. It's just the diagnosis of what it is, right? And it can sound that way. So most of the time in my practice, I'm not talking about your chi and your blood and your pathways in that sense. I'm making it okay. My patient's coming in. They have PCOS. How can I make this make sense so that they understand what I'm doing, that they trust me, and understand that we have a game plan, that I'm not just throwing needles randomly and hoping something sticks. And so in my office, I very rarely use my language, meaning the acupuncture language. Obviously, to my colleagues, we discuss it in both terminologies, in both Western and Eastern terms, because sometimes when it's an Eastern diagnosis, it's a little bit simpler to say, okay, we need to do this, this, and this. And sometimes it's easier when we speak it in Western. Okay, it's Western term. This is what we have to do. But with my patients, I rarely talk about all of that. Doesn't make
Right.
sense.
So tell us about your path. How did you get to this point?
How do you become a doctor of
Yeah,
acupuncture and Chinese
acupuncture.
medicine?
When I was probably a late teen, I suffered from chronic reoccurring urinary tract infections. And I was an athlete in high school that I was playing sports every day after school, didn't change out. And I was getting chronic urinary tract infections that bled into my first and second year of college. And I would go and I would get antibiotics and nothing was helping me. I was becoming resistant to all of the medications that doctors were putting me on. And at one point, I was put on an antibiotic for 3 months straight. I had to take it every day. And okay, like it helped me, but I got sick. Like
Yeah,
my
because you
immune
wiped
system,
everything out. Wow.
everything out. I was super sick. And so after I got off those antibiotics, the urinary tract infections started coming back. And so somebody mentioned to my mom, have you ever tried acupuncture? No. So I went to an acupuncturist. I think back to this time that if it were my child, would I let her go to the person? And I was like, I don't know, but he barely spoke English, like straight from China. The intake for I don't even know if he had a true license here. Like I can't tell you. You
Was
know,
this in
I hope
Florida or
that
where were you?
yes,
Okay.
in Florida.
Okay.
So like he's from China and the intake form is like Mandarin and English so he can see what I'm doing. And we barely communicated. But he could tell me exactly what not to eat, like to stay away from at that point to help my body heal, what to eat. And like I am telling you that he would give me these herbs, this herbal stuff in a bag that was already cooked. It smelled and tasted like tree bark, but I was desperate. And I went to acupuncture 2 to 3 times a week for like 4 months. And my urinary tract infections like were gone and I was feeling so much better. And I was like, wow, but naive me thought you had to be from China. So like that went away. I went to college. I have an undergrad degree in chemistry. So track, I was going to do research. I was going to possibly do medical school. I was doing something in the Western world. Like I have I don't know who gets a chemistry degree.
She's a
After I
nerd too.
graduated,
She's a nerd like us.
so when people are like, "Well, I don't believe it," and I was like, "I got you," so I can speak the language of both, right? Because my background is in science, is in Western. Like, I loved organic chemistry. Why? I
Same.
don't
I don't
know.
know.
I don't know. I loved biochemistry. I don't know. I loved it. I wanted to do research, and then I found out quickly that I needed to speak to people and needed to be not behind a lab,
Hood. Yes.
yes. I mean, it is for people, and I loved my experience in the research that I did in undergrad, but it wasn't for me. And so in the meantime, I was a school teacher. I taught middle school, sixth and seventh grade science, and then I taught chemistry. And during that time, that was my exploration of what did I want to do. I applied to a school down here to go into dietetics. Uh, and I started with public health. I think that was the first class I took, and I was like, I respect it. It's not for me. So I dropped that, and somebody told me, they're like, you could go to school for acupuncture. I was like, my mind blew. I was like, what? And so it was a cousin of mine who lived in San Diego. There are schools in South Florida, but like, I was like, that's what I wanted to do. I applied and I packed up. I moved across country to San Diego,
We're in
and I
San
went to school.
Diego. That's where I live.
The school that I went to is in Mission Valley.
Okay, cool.
Okay. And
Sign me up.
yeah,
Sarah's going to be
exactly.
going to night school acupuncture.
Yeah, I had not even been accepted when I had moved out there. Because you had to like have an interview. I didn't live in California. So I moved out there and I was like, I'm gonna figure it out. At the time I was working for Lululemon. And so I transferred there because I was like, okay, well, let me make friends and have a job out there. And I transferred out there in August. I started school in January.
Wow.
And then I went to school for acupuncture. It's amazing because I started school when I was like 26, which is old, but there were people that were in their 40s and 50s and 60s onto their second careers. They were nurses, they were physicians, and they had been burnt out. And they were in my cohort, and we had people of all walks of life. It was amazing.
That's too cool. And how long was the program?
I studied for 5 years.
Okay.
So it was
Okay.
4 years in person. So California, you can expect, has one of the longer, more rigorous programs. To practice in California, besides like 3 states, you can get a national board and then just do the credentials for your state. But California has their own board that you have to take.
Shocking.
And so I sat for the national board. I wasn't going to stay in California. I thought that I would have, but we moved back, and I mean, I could eventually, but I don't plan on moving back to California. Although San Diego is amazing and lovely and beautiful and
If I could turn
expensive.
my camera around, you'd see that it's gloomy right now. Great.
Okay, well, it's like the 1 minute of the year that it's gloomy.
She's always complaining to me about the weather, and I'm like, girl, you
Oh
live
my
in San
God.
Diego. That's like the best weather in the country. You
It
just
is
must
the
not be
best
a happy
weather.
person.
Mm.
That's so not true about her. That's so not true about her.
But you can grow a lot of avocados.
Me too.
Yes, she
Me
does.
too.
This is all like blowing my mind. And I'm just so curious because on one side, I have that Western science drilled into you, evidence-based medicine, evidence-based medicine. And I'm sure a lot of our listeners, as we're talking, they're going, this is too woo. And why are they having this
Sure.
lady on here talking? But I've also been on the side of medicine where, or I've seen it with my own patients where traditional medicine has kind of failed you and there are gaps and we're falling through the cracks. And so I've kind of become more accepting of some of these things. And like I said already, there are things like oil pulling, right? On one side, it's this ancient Ayurvedic practice that's been going on for forever. And so there must be some benefit to it. But I think also the side that I don't like about it is it gets oversold. So we get people coming online having conversations with me that are like, I don't have to go to my dentist anymore because I
That's
healed the holes in my
disgusting.
teeth. Right?
Yeah.
That is disgusting.
Yeah.
I
That
healed
is
the holes in my
disgusting.
teeth from oil pulling, and I oil pulled, and then every problem in my life went away, So there are a lot of grifters out there who are
There's too
maybe
many.
taking a little bit of truth and then they're distorting it. And then ultimately, a lot of times it's to make money off of people. So, coming from that side, I bet you get accused of
Sure.
those kind of things a lot. So,
Sure.
how are you incorporating evidence-based medicine? Are you working with other traditional providers?
My mom's going to a retreat. She says it's for learning, but I think it's just snacks and naps. You should come too, so she doesn't eat all the cookies by herself. Go to the doctorsonline.org to sign up for the cookies.
How do you help the patients who are falling through the cracks? Because certainly there's a place for what you're doing. And I'm just curious, especially coming from that Western mindset, how you meld both of those worlds together. Or how you would tell if
Um,
I was a skeptic as a doctor, how you would, talk to
mm,
me.
sure. First and foremost, I am probably a more one of the more central on this. I think most people should be central, right? Like their extremes are never good, one way or the other. Like in anything of life. Obviously, my first go to is going to be more holistic. What can I do more holistically? I go to the dentist twice a year. When I was pregnant, I went every trimester. I am a very big advocate of like be for real. Like we can do the other stuff, and Western medicine is there for a reason, and those practices are there. We know better, we know more. I am not a grifter. I'm not clickbait either. I don't believe celery juice is just gonna give you a lot of diarrhea. It's not gonna fix your problems.
But a medical medium figured that out after the ghost told them.
Right, like I can say I worked really hard for my schooling. It's really rigorous, it's a lot of work. These grifters and people that come out there, that's just a lot of noise, but most of us aren't that. Okay. We are also evidence based, but we also understand that in order to get evidence based research, we need money. And now, for a very long time, there was not a lot of money. Nobody was back in acupuncture because there wasn't a lot of money in acupuncture to get that research. And now it's a lot more accepted. There's a lot of doctors, both Western doctors that believe in it, that there's more medical data. They can hook people up on the brain, and when you get acupuncture you can see the areas of the brain that actually light up, which is amazing. And there's a lot more research and evidence now than when I started school, which every 5 years you're going to see more and more of that because it's been more accepted and there's more money that people are willing to put into it. Unfortunately, that's the name of the game, is if there's money into it, like, then we can get more information. With that being said, then it's our job as acupuncturists to put out the right information. I'm never going to on somebody, even if they badmouth somebody, even if I don't agree with them. It's not a good look for me. The place where I'm going to come from is education, and I'm going to link up with people that maybe don't understand or maybe are not accepting of it, but have more nuanced thinking that with a conversation can eventually be open to and willing to learn. I work with many medical professionals. I work with many MD, OB-GYNs. I work with many reproductive endocrinologists. I work with many orthopedics, all of that in the Western medicine. And we cannot not see that people are falling through the cracks of medicine, because if we don't have the right answer and the medicine isn't working for them, then what is our alternative? Is either number one, they're not going to be given the care that they deserve and or that they need, um or number two, they're going to hate on Western medicine, which we already have enough of that. Right, it's insurance companies make it really hard for doctors. And that was one thing that was really eye opening at Pinnacle for us, is that we didn't realize how much that these uh doctors are fighting the system while being in the system. And that's scary, because that they can lose their job, they can lose their money, and they can be jobless. Like, look what's happening with Dr. um
Potter.
Potter.
Hmm.
And that's scary, but they're doing the work. With that being said, we're your friends, right? I think I said this at Pinnacle. I stood up, I said, we get the disgruntled patient, we get the angry patient, and I can't do it by myself. Like, I would be a grifter, I would be a fraud if I told my patients that you don't need the blood work and or the medication or this while using the holistic stuff. That wouldn't be right or ethical. And so it's my job as the outsider. This is how I feel. I'm not speaking for our profession, but this is how I feel. It is my job to make it less woo woo for people to understand, right? I can practice as woo woo as I want, but if I'm always going to be speaking woo woo, people aren't going to believe that this medicine can help you when you may not need surgery, right? I could keep you out of surgery. And we have many patients that don't need surgery, or when certain systems are failing you, or hey, acupuncture has been shown and there is evidence to show that this can help IVF and the success rates of IVF. And why wouldn't we want the best outcomes for our patients? You know, I had patients that I worked with that got pregnant with me with no Western medicine that they were about to start. And so then they went to their OB-GYN and their OB-GYN told them to stop acupuncture because it was dangerous. I said, that is so wrong. Just don't say anything about it if you don't know about it.
Yeah.
Or be open to when I come and speak to you. So I'm making it my job. I'm currently working on baskets and I'm going to visit doctors around here to introduce myself and show, hey, I'm a serious practitioner. This is what I can do. This is what I can't do, and this is how I can help you. Because I see day in and day out patients that are going through IVF that are so frustrated because of the lack of communication between them and their doctor. And it's not always to the doctor's fault. And these nurses or medical assistants or PAs are overworked and underpaid. And so they have hundreds of patients that they're not getting to. And so I'm hearing about it. So how can I make this world a little bit easier for both the doctor and the patient? And at the end of the day, how can I get them out of pain? How can I help them get pregnant? How can I help with their anxiety or their depression or any of those things? And so I think that it's on me. Part of it is on me to introduce myself in a way that is accepted. Not that I'm going to just kind of pretend I'm somebody that I'm not, but I can't come in there and start talking a language that they don't understand. Like that's not fair either. And
Right.
so that's what I'm doing for my patients is I'm going out there. I'm trying to go on podcasts to explain acupuncture is evidence-based. Like
Yeah.
we are real.
I think
I want to
I just think it's so interesting because it is the lack of knowledge and understanding. And we deal with this very same thing as dentists, that people don't really know what we do. And people are like, oh, well, they just do their, snake oil or, their oil pulling or whatever they do. And it's really interesting because it's truly just a lack of education. So the only space that we can really help in that realm is through education, which I think you're doing a great job of. And so it's really nice to see.
It's hard when there's a distrust from your colleagues. I am fascinated by being on these like physician social media groups, like the private ones that you have to apply to get into. And Sarah and I have these conversations.
Very painful.
You're not any, and lucky. They're painful. From our standpoint, it's very painful because it's so interesting. I think just like the lay population is terrified of dentists, like a huge portion of them, our physician colleagues must be too, because there's so much distrust. So every little thing, like my child, the orthodontist recommended they get a palatal expander, and I just don't know what to do. And I'm like, that's a no-brainer. That is like such a no-brainer.
Yeah.
Like, get it. Your child doesn't have a space for their teeth
yeah.
and their airway and their whole facial development.
Yeah.
Like it's such
Well,
an
I think
easy
the
fix.
problem with that is that these people are touting themselves as airway dentists, and so then they look at the airway is their hammer, and so everything that they see is a nail. So it's like airway, 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 and you're like, you have to approach it from a whole patient, whole view.
Right.
Kind of like with what you're doing. Like we can't just prescribe medication. We can't just see the chiropractor. We can't just do surgery. We can't just do these things. Like everything has its space, and each patient is individual and totally different and needs different things.
But when you don't trust the whole specialty as a whole, it's really hard to accept that. So I think you're probably coming from an even harder spot. And I think that's got to be tricky.
It's not only for patients not trusting us. I think now we get the patients that they've tried everything, right?
Yeah.
And the system's failed them. And so they're coming to us. And I'm like, okay, how can we do this? Let's take a step back and let's start from the beginning. With that being said, we're also getting it from our medical professionals
Yeah.
where like they poo-poo what we do. And that's not cool either. Cause I would never like, although I may not agree with something or may not agree with the route, it doesn't necessarily have to be, well, you can do this or you need a hysterectomy. Like there's so many things in between that we should try and we should exhaust and provide that education for our patients. And so, like we spoke, this is a greater issue, right? This is a healthcare issue. This is the system that doctors are being locked in and their hands are tied behind their back. But it makes it, we start dehumanizing like different, like I'm sure you guys feel it. You feel like, okay, well, we're dentists, we're medical professionals. I'm a surgeon. Like I would I would trust you in a situation more than a general surgeon because like that I needed reconstruction on my face because like that is what you do. And there's no room for poo-pooing. And just because somebody doesn't understand, and that's my issue with it, is just because you don't understand something doesn't make it wrong and doesn't make it less than. Right? We all need each other.
My issue, evidence-based medicine, totally for it. I try to stick to the evidence as much as you can, but we're kind of in the similar, there's not as much research for a lot of dental things. There's so many questions we don't have answers to. And sometimes
Dry
we have
sockets.
practices. Exactly. We have so many like hoodoo voodoo things that we do. Like even like the idea of straws. Everyone knows you shouldn't use a straw because it causes dry socket, but there's not really much evidence at all. I was looking up, there's a study that showed straws and no straws that had no effect. But do we still say never use a straw? But we make
I say
assumptions.
don't drink a Frosty through a straw, but water's fine.
See,
You know?
and I still tell
but
my
who would drink a
patients,
Frosty from a straw? I would spoon that.
Right?
spoon
Well,
it
you'd be
every day.
surprised.
Why do
These
people like straws
people are
anyway? I hate straws. It's such a
Sorry,
hard thing going without your straw.
spoon.
But there's
What?
so much we don't know, and just because
What's
there's
a
not
straw?
evidence, you guys are both drinking straws. But my issue with it is when we discount things because there's no evidence. Just because there's no evidence for or against it doesn't necessarily. We just don't know. And there are
Sorry,
some
just because
doctors
there's no
that come
published evidence for
right.
or
They
against
come
it. There's
militant.
tons of evidence. Yeah.
They
I
come
mean, I have it in
militantly
my
about
office all the
things. Yeah.
time.
Yeah.
So
Right?
I
Like,
think there's
I have
millions of
evidence here.
questions that we don't have answered, and that there are
And
things we
that's
just haven't
okay.
learned.
Right? And that's okay. And because there's so many things and we're ever developing. And with that, why make another profession less than when at the end of the day, that profession can help your
Yeah.
patient. It can help
Yes.
them in many ways that you don't understand. And if you don't understand, that's okay too. It doesn't make you less than a doctor. It doesn't make you less than a person. It doesn't make me respect you less. What makes me respect people less is when they that area of, okay, stay within your lane, and when you don't know, either ask and refer out.
Right.
I do it all the
Okay.
time. I can't. I don't do ultrasounds.
Right. So can I tell you a story? It's a little bit of a TMI story, but we love that here. So this is the reason why I am so interested in what you do, because it really solidified in my brain how much I don't know, right, about the body in itself. So after my second kiddo, a year later, so I always had a little bit of SI joint, issues after my first, and then of course after my second. And then a year after I had my second, my hip was really bugging me. I had a surgery under general anesthesia, and it was hurting so bad that I was had a limp, right? I mean, it was bad. And after the general anesthesia, I was fine. I was good. It felt fine for a month, and then it was back. And I'm like, oh gosh, it's because I was paralyzed. And so it reset everything. And then the pain came back. So then I started with physical therapy, and my knee, I couldn't abduct when I would lay on my back with my legs at a 90-degree angle, or not 90, 45-degree angle, I
Right.
couldn't abduct my right leg out more than like 40 degrees. It would just stop. And I was like, I don't understand. So I was doing physical therapy. I had an MRI, none of the things. Everything looked fine. There's no reason for this. You've got tightness, whatever it is. So then I was like, well, maybe I can go to the pelvic floor physical therapist. And then I felt bad about scheduling it because I'm like, there's plenty of other people that probably need this more than I do, da 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 da. And so I went and she was like, well, do you mind if I do like an internal manipulation? And I'm like, this body is no longer my own. You can do whatever you want. And so she did. And as soon as she did it, my leg went, whoop, bam, and opened all the way up. Tears started
Wow.
coming
It
out
was
of my
like emotional.
eyes. It was an emotional release. And like, it was the most mind-boggling experience, mind-boggling, because that's what solidified in my brain, like how we hold things in spaces and like traditional medicine, doing physical therapy. Oh, it's just your muscles and your joint. It's not, it's so much more than that. And so like, I never discount people when they come in and they're talking about like their meridians and things. I don't understand it. And so I'm like, okay, I might have to read up on that, but with that experience, I was like, there's more to this.
Sure.
Wow. And I bet you see that all the time.
Sure. I'm sure that there's been times as you're in surgery and you do something and you're like, my mind just blew because I was able to do whatever it is and not believe that that worked. And I get that. And it's like this, wow, okay, what I'm doing, sometimes I don't understand, I know the point and I know the ins and outs, and sometimes I have to be more creative or try something just because I haven't tried it before, and then something happens. I was like, what just happened here? And it's an amazing thing, and sometimes you can't explain it.
Right. But I
Yeah.
feel like in your field, it really, because that's stuff that people aren't usually getting, right? Like they go to the dentist, they understand those things, but they're coming to you and they're already totally like they've written off the whole system and they are just at their wits' end, and you're able to help. Like I imagine this is what I imagine. I know that you don't have these days every day, but I like to think that you do.
It
That's all.
happens a lot.
Yeah.
Yeah, okay. I don't understand. So it makes sense to me when I'm coming to you for pain and you're sticking needles in me and I'm getting endorphins, or maybe it's something to do with inflammation or pain mediators, all of that. But you specialize in fertility. And me, I am an IVF survivor. I did like 6 rounds of IVF to get pregnant
Wow.
once. I went through a lot. They didn't know why it wasn't working. I'm that PCOS person that doesn't ovulate a day in my life type of thing. So someone like me coming to you, what's the strategy? What are you, quick and dirty? What are you doing? How are the needles helping me grow a baby?
So, first and foremost, bringing it back to this is acupuncture. We know that it can help reset the nervous system, which is an important thing. It's not the only thing. It's good. It is good for stress and all that, which we know when we're trying to have a baby and we're desperate to have a baby and it's not working, or we have multiple losses. There's a lot that, a lot of emotion stuff that comes with it. So first and foremost, that. In addition, acupuncture has been shown to bring blood flow to the reproductive system. It also has been shown to reconnect that signal from the pituitary gland from the brain to the ovaries. So I work with many patients that have PCOS. Some of them, I've had no luck getting them to ovulate on their own. Like, it happens because I see many patients, right? It's bound to happen. But a lot of them, putting them on a regimen to get their bodies to respond with the brain and the ovaries to release, so that your body's able to ovulate and grow follicle. It helps with that. It helps with the insulin resistance. So if people are PCOS and it's insulin resistant PCOS, acupuncture can help with that as well. It helps reduce the insulin resistance. And with that, it's not just acupuncture. We have them on supplements. We have them potentially on herbs as well. Interesting stories. I have a patient now who is in her early 30s, cannot ovulate on her own. She came to me. She started acupuncture. I put her on inositol, and she's had 2 periods. She has not, in years, she's never had a period. We talk about dietary, we talk about all that. So the acupuncture needles in itself, we put them throughout the body to help trigger those responses of the body, to help with the brain signaling and the ovary response to it, to grow the follicle, to release the egg, and all of that. It helps with blood flow to the uterus as well, to help thicken the lining for when we do ovulate. So yeah, I treat many PCOS patients, and a few of them, we need IVF, we need Western intervention. Even on like Clomid, it's no luck for them. And it help. Is that what happened with you?
Yeah. I didn't
Yeah.
ovulate even on those. Yeah.
Yeah, I've had a few of those, and then we go through IVF, and they do really, really well. They do exceptionally well. So a patient comes in, we have a consultation, we go over everything. What's going on? I hear the history. I need their blood work. I need their labs. I'm also big on male factor stuff. It just is. It's half female, half male. They are a big part of the equation. I always say, even if your sperm are super swimmers, we want to make sure that they are the best swimmers ever, and everything is perfect with them, because if your female counterpart has issues, once those issues could be resolved, we want you to be able to
Yeah, you could be swimming to
get
the wrong
pregnant.
shore. Not helpful.
Yes, the wrong direction. I mean,
Oh,
so
man.
I go through a whole consult. We go through lab work, we go through history, we go through all of the things, and from there I give them, okay, realistically, this is what I want to see. I want to start you off with 3 months. Typically takes about 3 months for sperm to regenerate and get new sperm, and I like to see patients through 3 cycles. It takes 90 days for the egg to finish maturing. I think it's a good amount of time to start with. It depends. Some cases are much more complex that we need other outside interventions. It's not a one size fits all.
Sure.
So the needles, they go in different places. We use hands, we use legs, we use head, we use feet, we use the ear. And with that, we could get the body to signal, like, all right, we need to get ovulation happening. We need hormones to be released. We need the brain to start to work with the ovaries. We need our thyroid stuff. I have many thyroid dysfunction patients, so I have everything.
One more question. So my first was a breech baby, and
The powers that be.
I read something about acupuncture and
Moxa.
hopefully helping to prevent maybe doing the ECV. But it was like this, all of a sudden I was reading about it, and then they were like, well, we've got to do the ECV, the flippy do.
Did it work?
It worked, but then I think he had a nuchal cord, and so his heart rate dropped. So we had to, and so evict. So how does acupuncture work in that realm of a breech baby, and hopefully trying to get them to wiggle around in the opposite direction?
So
swim to the other shore.
Yes, go down to the right shore. So so acupuncture in general could, but what you're talking about is moxibustion. It's an herb that we burn topically on the body. Sometimes it looks like a big cigar. Sometimes
I saw your video on this.
Okay. So that's moxa. Moxa is
mugwort. Is that what I read?
Mugwort.
Okay.
Moxa. Even OBs, like even our people that aren't believers, there is research behind. It's one of the only things that has been researched extensively to truly be able to flip a breech baby. So we burn it on one specific point, and basically what it does is it makes your uterus go from a studio apartment to a 1-bedroom, so the baby can flip comfortably. That's a easy way to understand to move it. With that being said, there are times I've had a lot of great success flipping breech babies, and there's always going to be those that don't, right? So basically, dependent on the position of the breech, right? Like there's different breeches, like they're, are they transverse? Are they head up? Are they frank breech, which they're like folded up? That has been very difficult for me, because that one, they're really hard to move. But for most of my patients, we have really great successes with that.
So cool.
Wow.
Also, people are like, well, if the cord's tied, I was like, I believe that if the cord's tied, the baby's not going anywhere.
Yeah, they know
But
better.
correct, right? Like, but when you manually flip, which you saw,
Yes.
you can. But with the moxa, in my experience, like the baby won't move, especially if there's like a potential for that.
Interesting.
Yeah. So I have one more question. What is your favorite thing that you do?
In my office.
Yes.
So
Or
I'm gonna
outside of
do
your
two.
office.
Well, I work out, and that's like my thing. But in my office, I love treating the complex cases. With that, they can be very emotionally taxing because with the highs of my patients, I go through the lows. And I feel it. Have to do a very good job of being able to protect yourself of that because the lows are low and they can be very dark. I love it because it my patients don't have to go through it alone. And it's a really beautiful thing to see this journey. Some of my patients' journey is 6 weeks and some of them is 3 years. And some of my patients, I see them through that. I love that. I do not get bored of treating my patients when it comes to those complex cases, especially my fertility. Like, it's amazing. And I also love doing, to balance that out, cosmetic acupuncture in my office and natural anti-aging in my office, like microneedling. So it balances it out. It's really,
Okay.
it's really nice. It's very light.
Yes.
So I love those things. And I love the balance in my office with that because I can do both.
And how many staff do you have besides yourself?
So besides myself right now, I have my office manager and myself. I don't take insurance. I also am a mom, and so I set up my office hours so that I can see patients and also be a mom. And so on Mondays and Wednesdays, I don't start seeing patients until 3. And so I stack my patients. I give them the attention that they need, but most of the people like want to chill with the needles in them. And then I go and I come back, I revisit, like if there needs to be a longer conversation, so I can manage that in that way. So I'm able to see 5 or 6 patients in an hour. And on Tuesdays, Thursdays, and Fridays, I'm here in the morning. And then in the afternoons, I can pick up my kids and we do our afternoon stuff.
And just as a curiosity, with those complex patients, have you found any strategies that have been successful? Because I am a massive empath, and nobody said, Sarah, maybe you shouldn't become a surgeon because you're going to feel everything that your patients feel. You're going to take all of it with you. It's going to be a very heavy load. And so I'm just dying for other people's strategies on how they are able to sort of protect yourself from the lows of the lows, if you, like you were saying.
It's hard. It's really hard. I remember when I was in school and we had to do our clinicals and I was just a supervisor. I was just like an intern and I was just observing before I would practice. And when there was somebody with like major stuff going on and I would go into there and I was like, why am I feeling nauseous all of a sudden? Like, why am I feeling like certain things? And I didn't understand what it was. And then I spoke to a teacher. They're like, you're empathetic, energy transfers. And it's a true thing. You should see me, like, if a patient comes in and they're like super high strung and I'm doing a consult, I feed off that. I have to talk myself through, like, you're talking too much, like, bring it down. Like, this isn't you. This is the energy that's being passed on, and get back to yourself. So it's taken many years because with the needles, we're transferring energy. I wouldn't let just anybody do acupuncture on me because if they're not right in the mind, like, what passes? And that sounds woo woo, but it's true. We know energy is real. And we know energy doesn't die, and it passes from people to people. And you can feel it when like somebody's energy is off. You feel that. And so what do I do? There's many different tactics that I was taught in school to separate myself. And through the years, I don't have to be as aware because I think I do it automatically. Is I like create a shield around myself, like imagery, and or like I do a figure 8 around me and my patient to show that we're separate. And also I put my feet on the floor and I'm like, okay, like pretend you're connecting down into the earth. This sounds like this is like very woo, and I don't share this because it sounds ridiculous.
I'm in
Like,
California. I totally get it.
but that's where I learned all of my teachers. Like, that's the thing is like
So
I like
California.
do those things. And that's where guess, but it's true. Like,
Mm-hmm.
it's hard to separate yourself from the people, and sometimes I feel myself angry, and I'm not an angry person, and it was because the person that came in was like angry, and I was like, this isn't me, so I have to figure out how to separate. And so I do different tactics that I would never share with my patients. This is so crazy because I don't share these things, but like, hey.
Thank you for sharing it right here on the Resting
That's right.
Space podcast.
This is the tea that we
get to the
love
nitty
because we all
gritty.
need it. Am I right?
But it's true. Like, I can, because I take it home. Another one is pretend to wash my body off. I will go into the bathroom here, and kind of wash my body off of whatever was just happening. If it was heavier, that is more if like somebody's energy was like bad, or they were mean, or it was like, hey, I gotta get out of here, and I'll sage my office.
That was
have
gonna
crystals
be
in
my
my
next question.
office. I have crystals in my office, things like that are just for me, or to keep it really clean. Yeah. I have lamps all through my office too. So
I feel like we could talk for hours. Can I ask one more question? I know
you
we
can,
need to let you
sure.
go. So after having twins and a 10-pound baby, my pelvic floor was a bit of a mess. And I remember asking my OB about it, and she's like, oh, your Kegels are straight, you're fine. And so it took a while before I ended up finding a pelvic floor physical therapist to help me. And I actually did like 2 whole 12-session rounds and, paying basically out of pocket to do all of this stuff. And it was really helpful. But I find so many women don't know that they can get help for this. And so it's just generally accepted that, like, I'm going to pee my pants when I sneeze and I can't jump on the tramp anymore. So I'm not really even asking a clinical question for you as a pelvic health specialist. I'm just curious how you talk to patients, or, because I remember telling a woman, she's like, what can I do? And I was like, oh, I was so excited. You can get physical therapy to help with that. And then she's like, so I have to get physical therapy every time I have a baby. And I'm like, well, maybe. I don't know. It just didn't seem worth it to her. And, I've heard in European countries, it's very standard that after you have a baby, 6 weeks later, you go and you just get the referral and you get the
There's
help.
a lot of standards that are helpful
And
there,
here,
right?
to me,
Yes.
it's such a issue. Like, to me, it just demonstrates that we don't care about women's health, that it's just normal that as you age, especially, you'll pee your pants or you can't sneeze. So
Or like,
what's your thought
sex is
on?
painful, you're old already, it doesn't
Yeah,
matter, right? Like,
it's just
things
how it
like that.
is. That's the result of having babies. So, like, what's your perspective being someone who sees patients like this? Like, is there a narrative that you kind of adopt and talk to people about it to
Sure.
spread the
I
word?
mean, I thankfully now we see a lot more information out there about it, right? Like, there's so many amazing accounts out there, like pelvic floor health and stuff like that, because um it can really impact somebody's quality of life.
Everything. Yes.
Everything. I I educate my patients. They're like, should I do this while I'm pregnant? I was like, well, why not? If you have the means to be able to do something like that, or or not, and try to just kind of like learn about it, I think that is going to help you after, because like, we know Kegels now are like not the only thing that matters, right? Like, most people, that's not the fix of anything.
Actually hurt you by continuously doing that. So
It can it can negatively impact you. And so we have conversations, even patients that have reoccurrent issues like infections. I was like, I try to understand a little bit more about if they gave birth. Was it vaginal? Was it C-section? And what help did you get after? All right. Well, listen, we've done X, Y, and Z, and you're still getting these things. You had a C-section. There's a lot of scar tissue that can build up there. It can make things really tight. I never want to um, put fear into it, because that's scary, especially when you're talking about your reproductive system. And I said, understand this, and like I have a pelvis and has the muscles, and I also have diagrams like with muscles, because again, if I talk in my terms, it doesn't make sense so much. But if I show them muscles and I show them how your recurrent back issues that have never gone away could be a pelvic floor dysfunction, I was like, we can impact that because you don't need to live with this. And so it's a matter of like educating them correctly, and just dropping seeds of information, and how can they help? Because yes, you're gonna most pelvic floor stuff is not covered by insurance. If it is, then then that I don't know anybody that takes that takes insurance with pelvic floor stuff, whether it's physical therapy or acupuncture, because it limits the creativity and like the customization that we can work with them, unfortunately. And I said, okay, well, if you want to do insurance, like you can try this person. I can't speak from them. But let's see how it can help you because it could change their life. I have a woman in her, I want to say late 60s, early 70s, that any vacation she was taking, she was half of her luggage was ads. And she's like, I don't want to do this anymore. And we've been working, and I haven't even had to go into the pelvic floor muscles. I'm working some of the other stuff, and she's not leaking anymore. And this has been going on for so
Amazing.
long. And for her, that's life changing. I mean, for me too, I also had a lot of issues with leakage, and I still do at times. But I did get pelvic floor, and I paid out of pocket, and it is really expensive. And to me, it's worth every penny of it. But I guess that's a privilege to be able to say something like that. Um, but yeah, I try to educate my patients in every best to my ability, and go at their pace.
Yeah, I think it's so
Love that.
interesting. When I started my therapy, my doctor was like, "Oh, just do Kegels." Well, when I went, we started with breathing. And it was just such a
Exactly.
demonstration to me that we hardly ever did anything that seemed like it was pelvic floor. I was like standing on one leg and doing all these very strange. And I would say after working out, I'd be like lifting heavy weights, and then I'd sit there and my kids are like, "What are you doing?" It doesn't look like I'd be doing anything, but I'd be like, "This is the
And
hardest
you're
work
doing your
of the
breathing
day."
exercises.
It was hard, or I'm like thinking about
Yeah.
twist this way and breathe in that way while you do this and that. It's tricky, but again, to me, it was just like, wow, there's so much about our bodies that I don't know about. So
The last thing also is that, remember I said before, it's like either you do this or you get a hysterectomy. Well, that's from doing these pelvic floor consults, evaluations for patients. And we had somebody that wanted to come in, but they weren't sure. And this person called, and she was telling me she's never had children but has like major prolapse, uterine prolapse. And her doctor said that either she could try this or she could get a hysterectomy, and like said it like it was nonchalantly, and she's like, that's like aggressive. So I went through and I educate her. I was like, there's so much in between, and why aren't our doctors telling them? And even if our doctors don't do those, like, why aren't they saying things, saying, hey, there's pelvic floor physical therapy, and what they can do is help X, Y, and Z. It may not resolve it 100%, but you can have a good quality of life with that. Or you can do pelvic floor acupuncture, or these are the different things, or I'm not sure, let me get you some information on stuff. There's nothing wrong with saying I don't know, and you're going to remove all of my whole entire reproductive system just because I'm in my 70s. But is it necessary? That's a major surgery. There's still a lot of people that don't know, and it's our jobs as physicians, in any capacity, to this is what's out there. So yeah, it's it's wild. It's the Wild West out there.
It is.
yeah.
So with
Thank
that
you.
said, we all live in different, literally, the three of us are spread out across the country. And so, and so how would you recommend an acupuncturist how do you recommend we start the search? Because here in California, on every other corner, there's some med spa that has an acupuncturist or a whatever, you know what I mean? And so how do you,
It's so saturated there.
yeah. Okay. Hey.
People can message me. I'm always open, like, hey, I live in such and such. And I have many colleagues that were all over the country and even in Canada. And so I'm happy to give referrals. But I would see, do they specialize in what you're looking to be seen in? Because even though we can do general stuff, I would never say that I'm excellent at treating eye stuff. There are people that are, but that would be like, I don't enjoy that, or diabetes type of thing.
TMJ issues.
Oh yeah, I do treat TMJ a
Oh,
lot.
hey.
I love treating TMJ.
That's because it's connected with the pelvic floor.
'Cause
Am I right?
We
Yes.
don't like treating TMJ, or at least I don't.
No, but acupuncture is so great. Let me,
Go to
yes,
you.
I had such a, in school, there was a woman that had such bad TMJ, she couldn't open her mouth. And she went to the dentist, and they didn't know really what was happening. And this was one of those moments in school. I was in my one of my last rotations, and my teacher suggested me to do certain thing and do one point, and I did it, and she opened her mouth. She went from like this to like, and I like, she started crying and I started crying. I was like, oh my
We started crying
goodness.
too.
Yes, because something's working.
Yes.
Yeah. So
Yes. You don't need a total
TMJ
joint
is
replacement.
hard. No,
Yeah.
TMJ is hard, and it's so painful, and it's so chronic and all that. But we work really well with that. I see a lot of TMJ people,
Cool.
and yeah, it's
Cool.
closely
Yeah.
connected to the pelvic floor, right?
Yeah.
Is that a thing?
No,
Yeah.
it totally is. I think that like a lot
Yeah.
of people with pelvic floor dysfunction also have TMJ dysfunction.
They
Yeah,
talk
I
about
believe it.
Mhm.
there's whole programs built off of starting with your occlusion and resetting everything from there. So yeah, I mean,
isn't the
acupuncture
body
and
all
oral surgery
connected?
are about the same.
I'm signing
It
up
is.
to go to
Do you
go
know
to the
that
school in
in
Mission
China
Valley tomorrow.
you're gonna go to
I wouldn't be
Pacific
surprised.
in China thousands of years ago, and I'm still certain that in certain areas that they use, when they do surgery, they use acupuncture, electroacupuncture as general like anesthesia, like
Yeah.
to do like issues like dental stuff.
I think this is definitely a place I had very
Fascinating.
little understanding. So I'm going to be thinking about this for a while. How can our listeners find you if they want to connect with you more?
I'm mainly active on Instagram at Dr. Andrea Acu and Wellness, and I have a website. But if you're local to South Florida, you could come visit me. I'm in Hollandale Beach, the Aventura area, but I'm mostly active on social media on Instagram, and you can DM me. I'm the one that answers on those DMs. And I'm happy to help anybody find somebody if they are looking for an acupuncturist or somebody that's legitimate that have passed my
Rigorous testing.
Your vibe check. That's great. Well, I
Can they
enjoy watching
juggle?
your content. You're a fun content creator, so I do recommend giving her a like and a follow.
Life is too short. Why be so serious? But I'm serious in my practice. I know what I'm doing. I'm not.
We
I
believe you.
promise.
Well,
Yeah.
thank
Well,
you
we love you
again.
so
Thank you
much.
for
Thank
having.
you. No.
Well, guys, I'll see you on social media.
All right.
Hey,
Thanks, Dr.
thanks
Andrea.
again.
Thank you so
Appreciate
much.
it.
See you later.
Bye.
Thanks for listening to another episode of The Resting Stitch Face. If today's conversation spoke to you, imagine what it would feel like to connect in person. That's exactly why we created The Doctor Is All In, a retreat just for women in oral surgery. Learn more and grab your spot at thedoctorisallin.org. We'll see you next time.